Welcome to Biocanic's Health Intelligence Exchange community, where leading practitioners in integrative health approaches will discuss how they solve the most challenging and common health issues. These regular Q&A discussions are designed to take a deep dive into case studies and integrative approaches in order to elevate the collective knowledge of both experienced and new practitioners alike. Biocanic's Health Intelligence Exchange, your community for functional medicine.
Welcome to the Health Intelligence Exchange, everyone. I'm Nicole Brors of Biocanic, and today I'm joined by our guest, Dr. Jeannie Achuff from Microbiome Labs. We'll be exploring how practitioners can optimize women's health through both gut and vaginal microbiome testing using Microbiome Labs' advanced clinical tools. Be sure to subscribe wherever you're watching or listening so you never miss an episode. And for those of you joining us live, we'll move into a Q&A session towards the end of the conversation, so feel free to start dropping your questions into the comments at any time during the discussion. Dr. Jeannie Achuff brings more than 15 years experience of clinical practice and healthcare education, serving patients in Northern California and Victoria, BC, while also supporting businesses through development and marketing strategy. Her work in clinical management, course instruction, and patient relations has shaped her expertise in mindful communication, sensitive issue navigation, and relational business practices. In addition to her role as clinical science liaison for Microbiome Labs, Dr. Achuff is a naturopathic doctor, consultant, speaker, coach, and writer. Dr. Achuff, thank you so much for joining us today. Let's jump right in. To start, can you kind of share how you became involved in microbiome-focused testing and what led you to your role at Microbiome Labs? Just tell us a little bit about yourself and how you kind of got involved in this world.
Sure. So my practice has always been largely focused in women's health, and I did midwifery training through my naturopathic program as well. So thinking about the microbiome from the early stages of life was always in the back of my mind. But this, my training was in the early to mid, when I graduated 2009. So in those years, we weren't really talking about the microbiome as much, but certainly probiotics were part of the narrative. And with time, we started to see these different tests that came on the market. And I was always a bit hesitant because from a naturopathic perspective, we're really thinking about the system of, and the terrain, thinking more holistically. And so for me to order a gut test and say, oh, this pathogen is causing all of these problems, that felt a little bit too limiting for me. So I kept my distance for a handful of years around microbiome testing, kind of going, I don't know if this is actually going to land me where I want to go, because if I pin everything on this one organism, there's a lot of other things going on. Like, how did that organism even begin to thrive in this system? What's going on with the terrain? So I tried a few tests over the years, and they're cool. There's some functional markers and all of these things. But then when the whole genome sequencing came out and was available to providers, I was like, this is different, because the microbiome really is its own terrain, right? Like this, it's its own system. And we're thinking systemically. There's so much nuance. There's so many relationships to pay attention to. And that's when I started to become intrigued with the testing. Microbiome Labs came on my radar around, I think it was 2015. A friend of mine was closing her practice and handed me some microbiome. I think it was the Megaspore. And I was like, oh, what is this? So that sort of opened the door. And I started tracking the company for a handful of years. And then a friend of mine, about a year ago, got a job with them. And he said, hey, the clinical team is expanding. You might want to keep an eye on this. And everything sort of added up in the right way. And I love being in an educational role. Mm-hmm. The nerdy part of me, it's difficult in clinical practice to get enough time to dig into research and stay on top of all of the latest developments in any aspect of medicine. It's even overwhelming at times. And in this job, it's part of my job description. So it was like, oh, it's time to dig in. This is going to be really fun. So I've been with Microbiome Labs for about 8 months now, I think, in this role. And it's
amazing. Yeah, it sounds like it's kind of scratching that itch that you had to kind of really be able to be on the forefront of the research and understanding of all that.
Yeah.
So for practitioners who may be newer to vaginal microbiome testing, how would you describe the clinical importance in women's health?
Yeah, so vaginal microbiome testing is indeed a very new arena that a lot of clinicians, I even find that my colleagues, I tell them what I'm doing with Microbiome Labs, and they go, "Oh, I had no idea that existed."
Mhm.
So when it comes to the microbiome, it's my understanding that we are between 2 and 3,000 articles published monthly across the globe related to the microbiome. So this is a very hot topic, but we
Mhm.
have a lot to learn. And so it's just in general, it's like we're starting to understand and appreciate that it's not just the gut, right? Like there are these gut organ axes. So it's like, how does the gut interface with the liver, the respiratory system, the skin? And in this case, how is the gut interfacing with the reproductive axis? So there's an increasing amount of research on, the interface between the gut and the vaginal microbiome. Um, both both microbiomes, they're related to each other, which we'll get into plenty today, but they both affect reproductive health. So, certain dysbiosis patterns have been in the gut have been correlated with endometriosis, with PCOS, with infertility. What's interesting, given like where we are right now in time with the research, is that I have come across articles that directly contradict each other as far as, like, for example, in endometriosis, which organisms are, partially responsible for the pattern of endometriosis. So we're not at a place where we can map it out and say, okay, if you're lacking this organism or if you're abundant in this organism, that's going to lead you down this road.
Yeah.
But we're starting to develop a roadmap.
Yeah. Kind of like a little bit of a lot of correlation right now, and then trying to figure out if that is also causation, it sounds like, before you say exactly this is the pathway and this is why.
Right. Yeah.
Yeah. And correlation, I feel like that's a first kind of indicator, like, hey, this is something we should look at. And then you kind of dig a little bit deeper into it.
Right. Yeah. And, to be fair, women don't always have vaginal symptoms in spite of still having vaginal dysbiosis. And so, some people aren't thinking to test. We're not testing everybody. Kind of to what we were discussing earlier, there's, I see a real place for the vaginal microbiome testing in preventive care, whether that's around fertility, whether that's around, just preventing certain conditions from developing. Yeah, it's a pretty exciting arena.
Yeah, absolutely. And I think just for women's health in general, because for so long it's, kind of been kept in the dark. Don't talk about this. Or if you do talk about it, like, we don't know that much about it. So here's a few things and we have to go research online. So the fact that we have this kind of testing available now, that we can like take a look and say, before maybe some of these symptoms, get bigger, before they become a problem, we can kind of take a look at those. Is there anything in particular, since we're on that topic, that that you have seen that comes up that as a preventative, like, hey, we know if we see this, like, this might lead to this, and so it'd be good to catch that early?
Yeah. So, we do know that people who either are what we'll call, just for the sake of this conversation, like carriers, or they're symptomatic, with BV, bacterial vaginosis, that can cause fertility issues. People, as I said, they're not always symptomatic. And just the mere presence, whether it's symptomatic or not, the mere presence of that organism can change, it's changing the pH, it's changing the overall structure of the microbiome in the vaginal, in that vaginal environment. But then how does that reflect up to, like, for example, in the uterus? And this is one of those areas of prevention where, it's really cool to see, I would say, the mainstream model. It's like they pick up on certain aspects of what we're also tracking in a more functional medicine realm. But I've had, over the last, I would say, probably only 4 to 5 years, an increasing number of women who are working with a fertility clinic, and they'll go in and the fertility clinic will say, well, we're not exactly sure what's going on, what's causing the fertility problem, but we're going to check the endometrial microbiome. We're going to do an endometrial biopsy. And this is interesting, right, from the microbiome standpoint. But what can we do to prevent that from ever even needing to happen? Because I don't know who out there has ever experienced an endometrial biopsy, but it's a procedure we'd like to avoid if we don't need to go into that. But further to that, the mainstream model, if they find something that is off about the microbiome, like, for example, if they find Prevotella present in the uterus rather than an abundance of lactobacillus, they're going to treat with antibiotics. And so that may clear the space for a moment such that fertility becomes, that it optimizes fertility. But then what are we looking at as far as the microbiome of the baby and the mom? And does that have an effect on how she proceeds through, the initiation of labor and birthing? Like there's a lot to consider. So if we can get ahead of that and test the vaginal microbiome before someone is trying to get pregnant and deal with issues at that level, that's brilliant, I think.
Yeah, absolutely. Having to avoid that kind of procedure, I can imagine, especially when you're going through the fertility process.
Yeah.
Yes.
Yeah.
Yeah. And also, antibiotics, we know that can be a big disruption it's not usually targeted towards just that one bacteria. So I think all those questions are really, really important. So thank you for bringing that up and kind of diving into that. I'd love to hear a little bit more about how gut health kind of directly influences vaginal microbiome through the mechanisms such as hormone pathways, inflammation, detoxification, and immune regulation. Yeah. And feel free to go down either one of those or take that. That's kind of a very broad question, but, just kind of seeing how those kind of correlate to each other and the pathways.
Yeah. Well, I think to your point, there are so many tangents when it comes to the microbiome. It's like, oh, we could go down this avenue or this avenue. And it's all really interesting. So we know that gut barrier dysfunction, it propagates inflammation, not only in the gut, but in distal organs. So for those of you who have been in the microbiome conversation for a while, you'll recognize when I say there are gram-negative bacteria present in the gut. When those bacteria die, which all of them will, and they do through a natural life cycle, and they often die when we eat, right? It's like the stimulation of anything changing in the gut will stimulate these organisms to die, which results in the release of lipopolysaccharides. So the lipopolysaccharides are highly inflammatory, and that can lead to a leaky gut barrier. And when that happens, then we have all these more, these pro-inflammatory molecules that are in circulation in the blood. So, different people are going to have different organs affected depending on other aspects of their health situation. But let's, sticking with the vaginal microbiome and the reproductive microbiome, we see this pro-inflammatory state that originates in the gut is affecting the pelvic cavity or the peritoneal cavity. And so that's the cavity around which, or, that surrounds the reproductive organs. And if we have pro-inflammatory, molecules and cytokines and things in that area, then how is that affecting the organs? They're sort of swimming in this fluid that is inflamed, essentially. So that's a more almost like direct mechanism of how gut barrier dysfunction and a leaky gut can affect those organs. But we also see, there are correlations, like if I'm looking at someone's GI test and they have a decreased, say, bifido population, that is often correlated with, down the line, compromised lactobacillus population in the vaginal microbiome. So that person may be more susceptible to yeast infections or BV. In some cases, like if you don't have a properly balanced vaginal microbiome, the pH is off and you are also more vulnerable to sexually transmitted infections. So what we want is a healthy lactobacillus population in the vaginal microbiome. And that is supported by a healthy, for example, bifido population, along with a healthy keystone population in the gut.
I love that you brought that up as well, because I remember when I was in practice and I would have women that would come with recurring yeast infections. And the first question I'd always ask is like, how is your gut health? And every single time it was like, and I wasn't at that time, this was 10 years ago, I wasn't doing, a lot of advanced testing, but just knowing the little bit that I knew about that, I was like, how's your gut? And every time, as soon as we started fixing their gut and fixing their gut health, like all this went away. And so, it's to hear the science behind that and to say like, hey, now we have science to back up what we were doing. And I remember at the time too, even seeing some like doctors that were well known saying, hey, there's not a connection between this online. And that just drove me nuts, because I'm like, we might not have the evidence yet, but I see this happening. So I love that you brought that evidence up. I think that's so powerful for so many women to be able to hear that.
Yeah.
really feel like justified in what they're feeling and what we know to be true.
Right. Right. It's like we had these inklings, years ago. The same thing. I would always ask about digestion and liver, how's your liver doing? Because if your liver's not clearing well, if it's not functioning well, that waste has to go somewhere. And that, what's the downstream effect? And absolutely, I've had the same clinical experience as you. So it's really satisfying to go like, okay, I can now point to these, to this evidence that links all of these pieces. Yeah. So, and actually that relates, I would say, to the question around like detoxification. So a healthy microbiome is not producing a high number of pro-inflammatory metabolites and byproducts like the LPS, but a dysbiotic one is. So a healthy microbiome is able to conjugate and carry out waste products. It appropriately carries out, excessive amounts of estrogen. The bile acids, primary bile acids, should be converted in the gut microbiome to secondary bile acids, and that keeps them moving, whether it's that they're getting reabsorbed or they're getting excreted, but it's, appropriately shuffling the bile acids around, and there's no bile acid stagnation. But if we don't have a healthy microbial metabolism of bile acids, which is, part of a dysbiotic gut, then we can either see diarrhea because of the excessive amount of bile acids in the colon and the body's trying to flush them out, or constipation. Things can slow down when there's insufficient amount of bile acids. So the microbiome is important. There are certain organisms that are responsible for essentially, we'll just say like managing the bile acids. And bile acids are mucosal irritants. So then that can increase intestinal permeability and activate inflammation pathways. When the bile acids are properly converted into secondary bile acids, that suppresses the pathogenic bacteria and can help to promote appropriate microbial diversity. They help to promote the regulatory T cells, supporting proper immune tone. So reducing, or properly managing the bile acids leads to management of inflammation and, prevents that dysregulated immune signaling. And then if not, with the bile acids, if they're not converting properly, that can reflex back to the liver. So kind of to our point earlier, and that can compromise liver function. It takes a while, but eventually you would see some, cholestasis, some hepatocyte injury. You might be able to appreciate elevated liver enzymes, which we do see, like someone who, I'd say an extreme case of this would be someone who has undiagnosed celiac. I don't know if you ever saw this in practice, but I've had a few patients for whom the diagnosis came through quote unquote mysteriously elevated liver enzymes, and they had no other symptoms, but those liver enzymes once investigated revealed a significant amount of gut dysfunction and dysbiosis and compromised titrations and everything because of that celiac disease. So, that's an extreme version of it, but that's kind of a good demonstration of how things can go wrong as far as detoxification and the accumulation of inflammatory, molecules within the GI tract.
Absolutely. And also knowing just how important the liver is to our hormones and how important the detox pathways are as well for women's hormones and their fluctuating cycles. And so it all kind of connects. It all kind of comes back and connects in that way. It's this that affects this, and then that affects this.
Yeah. Yeah. And to the another arm of your question, if you want me to elaborate.
Yes, go there.
So so a dysbiotic gut, when it comes to estrogen recycling, right? Like a dysbiotic gut can include increased populations of the organisms that are going to recycle estrogen, effectively keeping it in the system. So most of us have heard about and looked into the concept of the estrobolome at this point. So if we're not excreting appropriate amounts of estrogen, and it's getting deconjugated and then recycled back into the system, then our tissues are getting exposed to higher than physiologic levels. And I think it's important to note, when we look at a biomefx test, obviously we're testing both men and women for their gut health. And I do see men with elevated estrobolome. So it's not, this higher what do I want to say? This increased recycling of estrogen can happen in anybody,
Mhm.
but of course the effects are going to be different depending on what tissues it's affecting. So for women, think about these hormone dependent conditions, like, we mentioned before, endometriosis, adenomyosis, PCOS, fibroids, certain cancers and menstrual disorders, like, all of these hormone sensitive conditions will be responding to that increased presence of estrogen and from a dysbiotic gut, that higher level of inflammatory markers and cytokines circulating through the system. So, we want the microbiome to be wise and balanced in its management of organisms who are, deconjugating the estrogen. We don't want too many of them. So that's, keeping the community in check and making sure that we're excreting appropriate amounts is really important for not only systemic health, but, also at the vaginal level. And, we'll probably circle back to this as we talk about other aspects, but we also want into our menopausal years, we want to have an appropriate amount of estrogen recycling, right? So like what's appropriate for a 25-year-old is not necessarily appropriate for a 65-year-old.
Mm-hmm. Yeah, absolutely. And thank you for bringing that kind of full circle. I love how informed we can get from the gut health to seeing how that really directly affects hormones, how that really directly affects, the vaginal microbiome. So thanks for kind of going down all this little divergent paths. I love it. Just helping us really understand the mechanisms of it and why everything is happening. Can you just take a minute and kind of walk us through the vaginal health test from Microbiome Labs? What markers does it measure and how should clinicians interpret the results?
Yeah. So the test, it's fairly straightforward in many ways. Something of note is that when we're testing a gut microbiome, we want diversity, right? Like we want a wide array of different organisms and a healthy keystone population. When it comes to vaginal health, we want low diversity during the reproductive years. So what's physiologic for women, once they start their period until they hit menopause, is a limited amount of microbial diversity. So, and that's obviously important when we're looking at testing people and kind of like, where are they, what's going on with them as far as time of life. So when you look at the test, the first page of the test will show you a circular graph. It's actually a ring. So it's not like a pie graph, it's a ring. Mm-hmm. And that ring depicts what percentage of various organisms are present in the microbiome. So you might see a chunk of the ring, a certain shade of purple or red. What we're screening for when we perform this test is, yeast, staphylococcus, E. coli, opportunistic bacteria like Prevotella, Gardnerella, which is one of the primary organisms responsible for BV. Mm-hmm. So if any of those are present, we will see them depicted as a percentage of the population on that ring. And then there's a list as well of the lactobacillus population. You get to see the relative abundance of each of those species present in the sample. But what we want is a lactobacillus dominant microbiome. So what we're looking for, and not all lactobacillus are the same. So, what we're looking for is a certain group of lactobacillus species, because those are the ones that indicate the healthiest vaginal microbiome.
Oh, amazing. And it's so interesting, the difference between having all the diversity in the gut microbiome and then knowing exactly, it's like, it's not the same, just understanding that the difference of the microbiome and how that kind of relates to, different pathogens or different, symptoms that might arise from that.
Right.
While we're on the subject of testing, what makes the biomefx stool test distinct from other stool tests on the market? And how does it help practitioners kind of build more targeted protocols?
Yeah. So I would say we're in an exciting time when it comes to stool testing. We're seeing a lot of innovation in the tests that are available. Lots of interesting conversations around what's possible, what's relevant. So with a biomefx test, we're assessing the microbiome through a whole genome sequencing approach, so also known as shotgun sequencing. So the biomefx test was one of the first on the market, not one of the first in general, but on the market available to healthcare providers. So I would say it was part of the changing conversation around how we're approaching stool testing from a clinical standpoint.
Mhm.
What makes this approach different is that it is a functional analysis of the microbiome. So we're not just looking at a list of, who are the organisms that are there, but what we're doing is we're looking at the genes. We're assessing the microbes that are capable, or what the microbes are capable of doing, by evaluating which genes they carry and then the metabolic pathways that those genes encode. So for example, the genes that encode for fermentation patterns, whether it's fermenting proteins, fermenting carbohydrates, the genes that code for short chain fatty acid production, bile acid metabolism, like we discussed before, neurotransmitter signaling, detoxification, all of these different markers. So it really gives us a sense of what's actually happening in the gut, not just who's there. So for example, what I referenced at the beginning was the stool tests that I was exposed to, in school and early in my practice were the tests that, like, for example, that employ the 16S RNA technology, which again, it's a list of who's there. And what happens, I think, just from a brain standpoint, as a clinician, is that we end up going down that road of like, okay, these are the good guys, these are the bad guys. Oh, look, this person has bad guys. We have to just eradicate the bad guys and let's hope that we spare the good guys while we're at it.
Mm-hmm.
So it's like it automatically kind of, just puts our mindset into more of that. What I would say, it's a less holistic approach. It's really, it's easy to forget the terrain. It's easy to forget the question of like, why is this organism
exactly like what how did this happen? What are the mechanisms behind what's going on? And this sounds like it's giving you the mechanisms as to why you're seeing that picture. So then you're not just the kind of symptom pill mentality, but more like, oh, this is getting to the root causes and what's really going on. And then we can fix that. And then, downstream, that will also it'll help balance out those bacteria.
Right.
Sounds like.
Yeah, because we're looking, when we're looking at a whole genome sequencing test report, what we're seeing is the landscape of that community, essentially, kind of, so, who's there, but what are they doing? And whatever they're doing, how is it affecting this guy over here? Right. So I tell the healthcare providers that we're working with as consultants, I say, remember that we're really talking about relationships here. It's the relationships between the different organisms in the microbiome. We're focused on the web. We're not focused on individuals. So an example that I see coming up a lot recently, I would say, is that we have the keystone species, right? The keystones they're not the only organisms in the microbiome by any means, but they're ones that play, from a functional perspective, they play a major role in kind of creating the environment, creating the dynamics that are at play. So they're the short chain fatty acid producers. They're, creating different metabolites that are promoting, proper neurological function or detoxification or, all the things that we've discussed previously. There's one keystone species called Phocaeocola vulgatus. And this guy I see elevated a lot lately. It is a keystone species, so we don't want it to go away, but it can become abundant when other species are deficient. And particularly, I see it elevated when the bifido populations are low. So we want a healthy bifido population. The bifido populations are a really nice, I always think of them as sort of like the central pillar of the microbiome. And if they're not doing well, then other organisms start to fluctuate. Maybe they aren't able to even thrive. And so we don't see those on the keystone list. They're not detectable because the other organisms with which they have a relationship aren't present. So for example, the bifido. So the P. vulgatus, when it starts to take up too much real estate, the ecosystem gets tilted towards inflammation. In proper balance, the P. vulgatus is not a pro-inflammatory organism, but once it becomes abundant, then we start to see more inflammation. We start to see mucin degradation. We don't want to kill it, right? It's not necessarily a bad guy. We need to bring the system back into better relationship. So it begs that question, as we touched on before, like, well, why did this happen? How did this guy start thriving, and in what environment does it thrive? So, if it thrives in, and I actually, this is something I should look up, but what's the optimal pH for P. vulgatus? Well, it might be that the optimal pH is the pH that exists when the bifido is no longer strong, right? So there are all of these dynamics. There's all these microbe dramas going on that we are monitoring when we look at the stool, the microbiome from this angle. And it's really about orchestration, right? It's not
I
about
love that term, what'd you say, microbiome drama or micro? Yeah, I like it.
So we should start to talk about
drama. There we go. So how do you think that practitioners, what would be a good way to use the combined data from the biomefx and the vaginal health test to kind of create a more complete multi-system care plan for women? Kind of, how do you see those working together, and how would that kind of facilitate their protocols and protocols moving forward, I guess?
Yeah. So, man, my brain just jumped to the Biocanic platform and what you guys are up to. So I'm a believer that I think testing at the same time is really beneficial. On one person, if you can get within the same day or two a vaginal sample and a stool sample, then we're going to have a picture of, okay, like what's happening at this point in time. Both of those environments from a microbe standpoint are, they're always evolving. There are fluctuations from, hormonal changes through the month. Of course, a woman's vaginal microbiome is going to be shifting and adjusting. But what we want is to get a baseline of what's happening in each environment and how are they reflected, in each other. So I would, I think it's, if we were to take those two tests and test results and put them into the Biocanic platform, I think there's a really cool opportunity there for correlating what we see on the gut test with what's reflected in the vaginal test. And it's possible that you're going to get a vaginal test that looks really beautifully in balance. And if the person's asymptomatic, then that's great. What you've got is a baseline, right? Like I think we have to remember that there are times when I'll see reports or I'll talk with a practitioner and they're like, there's not really anything exciting here to look at. And I say, well, that's great, because now we know that this is, assuming the person's asymptomatic, that this is probably a place where their system is in a really good spot. So we have something to refer back to if they start to become symptomatic, and we can say, okay, this is your particular balance point. But, for most of us, I mean, I've yet to see like a beautiful gut microbiome test in the absence of any symptoms. I mean, most of us have something going on. So it's a matter of, utilizing that information and working. When we work with the gut, it is reflected in the vaginal microbiome. So, if there's something going on with the gut and nothing detectable at the vaginal level, then what we're doing is we're preventing anything from eventually translating into the vaginal health realm. But if there's something that's distinctly a vaginal symptom, we have to remember that it's not an isolated system over there. We need to make sure that we're addressing the big picture. And the recurrence rate, I mean, I think so many of us who've worked in women's health find that the recurrence rate of BV and yeast, it's extremely high. So great, deal with the symptoms, help them to feel better, resolve what's happening right now, just so that they're comfortable moving through their day. But don't stop there, use the information that you can get from the stool test to really redesign and rebalance what's happening in the gut.
Absolutely. I think that's such great advice. And you mentioned the Biocanic platform, and I know that with our Nexus product, I'm really excited for this to come out because of the analytics that we have, and we're able to pull all the data from the test. It would be very interesting to see, once we're pulling all the data from the stool test and also pulling all the data and all those data points from the vaginal microbiome and kind of seeing the correlation engine on those. And, this is always high when this is always high, or this is low when this is low. And then how does that change pre and post treatment? I think that could definitely uncover some additional insights. So it'll be interesting as we kind of go along and we have more practitioners that are using those tests to be able to collect that data and see if we can uncover even more than it sounds, I mean, there's already so much that we do have insight to, but just to even see that, I think it's a really exciting place to be.
Yeah. And for the patient to see that all in one portal, right? Like it's a really, if I'm understanding correctly too, they can see their test results and then also see the recommendations that you've made accordingly. That's really useful for someone from a clinical standpoint, because we're all guilty of going, oh, I did this thing for a couple of weeks and I felt better. And then I fell off the wagon because I felt better. It's like, you gotta keep on it, right? It's like we don't stop exercising just because we felt strong one day.
Yeah. That's such a great analogy. Also, I think that sometimes when people start to feel better, they don't always remember how they were when they started. And that's why I love when people can see oh, here's the tracking and trending of it, your markers when you started or your symptoms when you started and how you have gotten better. And they're like, oh yeah, that's right. That's cool.
I have a mentor from school. It's just reminding me, who used to, I wonder if he still does this. He used to take a picture on the first day that he saw people, like their first clinic visit ever. And then after a certain amount of time, after they'd been through whatever big processes they'd been through, he'd take another picture and go, look at the two versions of you, and just a really nice representation of, what the work that we do for ourselves is reflected, throughout our body. Right. So it's kind of fun to see that represented in whatever way we can show it to our patients. Yeah.
Yeah, absolutely. Because there's so much. There's the brightness of the eyes and the skin and the overall energetic kind of feeling that they kind of bring into a room.
Yeah.
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 So going back to kind of reviewing the vaginal microbiome results, and I know we've touched on this a little bit, what patterns tend to correlate most strongly with the symptoms, like recurrent infection, dryness, cycle irregularities? What are some of those correlations that we can see from the testing results to the symptoms?
Yeah. So this is a great question, and this is going to lead to a key piece that I want to make sure people understand is that so about 12, 15 years ago, something like that, there was a research team at the University of Maryland who categorized what we call the community state types. So on our test, we do outline the community state types, and there are 5 of them that have been understood at this point or identified. Community state type 1 is what's considered to be the most stable. It's marked by low diversity, better fertility outcomes, more resistant to disease. So community state type 1 is dominated by Lactobacillus crispatus. And this one is, I want to just have a little caveat on here because it comes up periodically, and I'm seeing it come up even more. There's an interesting pattern that some people are seeing clinically called cytolytic vaginosis. So what can happen, and I'm seeing it most commonly with the community state type 1, is that people are symptomatic. They have discharge, they have itchiness, they have some discomfort and pain, and they get a vaginal microbiome test back and it's all L. crispatus, and they go, I don't understand why I'm so symptomatic. I have the optimal community state type. Like, this is how it's supposed to be, right? We can get into an abundance of the L. crispatus, and for some people's tissues, and this is, I hope, an area that we can start to understand. For some people's tissues, for whatever reason, that becomes too acidic. And so this term cytolytic vaginosis comes from essentially the cells are breaking down in the presence of so much acidity from this lactobacillus strain, causing symptoms that look like BV and yeast. So I've had a number of consults already where this is what happens. They say, I don't get it. It's perfect. And I have all these symptoms. For those people, we're actually saying, hold off on the probiotics. We need to let the vaginal microbiome readjust. So, and there's not a lot of research on cytolytic vaginosis. It's really, unfortunately, an understudied arena, and very few people can even get a proper lab-based diagnosis. Like, what we need is for someone to be able to go into an office, have the clinician sample the fluid, look at it under a microscope, and confirm, like, yes, the cells are effectively rupturing because of too acidic of an environment. It's it's kind of too much of a good thing. So,
well, I think that alone is such a powerful insight because, typically if you're like, hey, I'm having these symptoms, let me just go take a bunch of probiotics. I mean, hopefully not anybody that's just coming to us, we're doing a little bit more than that. But, I think for a lot of women that are out there, they're like, okay, I do know a little bit about this. Let's take some probiotics. And that is actually the opposite of what they should be doing when they are in that state, because that's not the cause of what's going on.
Yeah. And it's really I would say it's really a case for testing. It's really a
Mhm.
case for understanding what is actually going on in there.
100%.
So to just flesh out the other community state types. So
Mhm.
the other organisms, state type number 2 is dominated by by Lactobacillus gasseri. This one opens up the environment for a little bit more diversity. So it's slightly less stable, but it's still considered healthy. So if that one were to show up, we kind of go, okay, pretty good. Maybe we can support this, whether it's through, looking at what's happening in the GI and, maybe through that avenue. I would say that's the best approach to take. But, every clinician is gonna sort of know their patient and know what's the best next step. Community state type 3 is dominated by Lactobacillus iners. So this one's interesting because this one actually produces the lactic acid that is typical of the Lactobacillus species, but it's producing a different isomer. And so it produces the L isomer of lactate, it's less preventive of the destabilizing factors. So it's basically a more fragile environment. It's not inherently pathological necessarily, but people are more likely to have symptoms. They're more vulnerable to like BV and sexually transmitted infections. CST4 is generally more diverse, has a low lactobacillus count kind of across the board. We're more likely to see other organisms like the Prevotella, the Gardnerella. There's a higher risk for, or there's a higher pH, so it's not as acidic, and generally can be more inflamed. And then the last one is community state type 5, and this one is dominated by Lactobacillus jensenii. So this one is also considered healthy. It's a far less common community state type than number 1, and it is slightly less stable. But when we see it, people tend to be in a pretty good balance. So that one, that one's just sort of interesting to note. I would still support from a GI standpoint. But yeah, I like that we have this kind of, to our point earlier, there's so much of science and research and medicine that has not been focused on women. And it's like to have this outlined, and to have a sense of like, well, what actually do we want to be happening in the vaginal microbiome it's great, right? It gives us a map.
Yeah, absolutely. It gives us a map, gives us the insight, allows us to take the right path forward and not just be guessing or, as I hear a lot, like people watching TikTok videos, but actually saying, yeah. So you can actually get some insight into what exactly is going on and knowing that this information is now out there and there are people that we can trust to go to have them help us in this way.
Yeah.
So appreciate all of that. What are some of the most common misconceptions you see around vaginal microbiome health, especially in functional and integrative care?
Yeah, good question. So I do hear people expressing surprise. I mean, even you did express a little bit of surprise, like, oh, it's not a very diverse environment. So I think it's important to remember that we really do want a limited number of organisms in there, and very, very few. And we want them to be primarily lactobacillus. So, and to that end, actually, I would say a really prevalent misconception is that lactobacillus is lactobacillus. It's not. We functionally, they're not all the same. Like, so as I pointed out earlier, that the Lactobacillus iners is producing lactic acid, but it's a different isomer. And so that's going to have a different effect on the tissues and the environment. That Lactobacillus crispatus is really the one that we want. And so if we're trying to reestablish a healthy lactobacillus population, that's the strain that we should be going to. And I would say there's more and more formulas that are coming on the market that contain that. The Microbiome Labs has a formula called Vaginal Balance, which is a really great formulation of the crispatus, the jensenii, the gasseri, and the which one did I miss there? It's the four that we want. Track my but what we want to be doing is emphasizing that lactobacillus crispatus, and we want that to be backed by a healthy gut microbiome. And what we do know, and this is another, I would say, I don't know if it's a misconception, but maybe something that people haven't totally thought through or haven't, seen the research to prove this yet. But we know that certain strains, and the Microbiome Lab strains have been researched and shown to do this. When taken orally and ingested into the gut, they do translocate into the vaginal environment. So taking an oral probiotic, if it's the right strain, is going to support rebalancing that vaginal microbiome.
That's wonderful insight. Can you also maybe share what role like lifestyle, and I mean, there's many, I'm sure, but lifestyle and environmental factors play in shaping the vaginal microbiome, and maybe some practical recommendations that you find most effective for clients?
Yeah.
I know. I was like, there's so many things. I know this could go many ways, but maybe some of the more prevalent ones you see, or some of the maybe biggest ones, or most maybe not well-known ones, wherever you kind of want to go with that.
Yeah. I'm hoping that I don't have to say this, but I'm going to say it anyway. Don't wash yourself out with soap. Don't deodorize. I think that's all our grandmother's wisdom, right? Like, hopefully we got that memo a while ago. But if something's amiss, ask the question. What can I do differently? How can I create a different chemistry for my body? So diet for sure. Eating plenty of fiber. So, and I'll preface this too with like, first and foremost, get rid of, or at least really reduce the refined carbs, right? Whether it's refined sugars, bread products, flour products, things like that. Eating plenty of fiber from a diverse array of foods is going to help support a really healthy keystone population in the gut. The polyphenols that we get from chocolate, green tea, pomegranate, grapes, onions, artichokes, these kinds of foods, all those polyphenols are supporting healthy keystones as well. And remember, herbs and spices count. So adding cinnamon to your food, putting cilantro on your tacos, whatever it might be, that helps you get to that 30 different foods that we're supposed to be eating every week to support a healthy microbiome. I mean, some of these are going to be kind of repetition for a lot of us, but choosing organic, remember that glyphosate was developed as an antibiotic. So, and I really interesting, just side note here. When I look at the test of people who are above, I'm going to say like above 75-ish, 70, 75, their microbiomes look slightly different than someone who's 30. And those are people they grew up eating largely organic food just because that's how food was, right? And I look at the younger populations and people who, were raised in like the 80s and 90s, especially people who were born in the 90s, like the amount of chemicals that have been in their food since day one is massive. So a lot of those individuals have some, kind of cleaning up to do. So the organic choice really does matter when it comes to the microbiome. So locally grown, heritage grains, things that are, appropriate for your bioregion, all of these kinds of things. And then another grandmother's wisdom, I would say, just, like, what are you actually doing locally for the environment? Well, wear cotton underwear, get out of your sweaty gym clothes. Like, all of these things count. I came across a new underwear brand. I can't remember the name of it, but they have I think it's a zinc oxide infusion into the lining of the underwear. I need to look into this, but it's kind of like, what can we do as far as, clothing that we're putting up against our bodies, and is that potentially protective or, damaging?
I think that's such an important point, because to your point, I've heard of just a lot of clothing brands in general, especially like with the cheap fast fashion that people are buying from whatever shops, wherever they are. But But there's a lot of those now that they're finding have a lot of chemicals in them, not super surprisingly. But if you think about any of those things that you are putting around somewhere that has a very delicate balance of bacteria and what it's being exposed to, I think that that is a really important factor to consider.
Yeah. Yeah. And it'll be interesting to see if those companies respond, because I know one of them was really on the hook, really getting targeted in the last year. And we would
Yes.
not name names, but, leisure wear and such. And yeah, it does bring us back to that question of what are we putting on our bodies on all levels?
Mhm. Yeah, 100%.
Yeah. I
And
would say stress too. I just want to emphasize that stress really does play a big role.
yeah,
In making sure that you're managing your stress and looking at, back to the why. It's, if we're really looking at why are we out of balance, there's so many ripple effects, right? But I don't know if this was a part of, I don't think we covered this in the intro, but part of my practice was on, I guess still is technically, I don't do much clinical work anymore, but I did manual pelvic floor work. And so a lot of fascial release. And, with that comes a lot of emotion and a lot of, looking at one's life and relationships. And the pelvis is a really, it is a very reflective part of our bodies. And so I always just have to bring people back to that. If your microbiome is out of balance, you have to ask the question of like, what are my literal emotional boundaries? Like, am I porous? Because if we're porous at an emotional and psychological level, how else is that translating? What other boundaries? The boundary of our GI lining, the boundary of our vaginal lining, like
Mhm.
I have seen, and I know this is not hard science that's happening over at Harvard or anything, but I have seen that when we work on our emotional boundaries, when we claim our no, not just sexually, like it's about anything in our life. When we bring ourselves to a safe and centered place, we're not as vulnerable to pathogens.
Mhm.
So there's that other layer there, right? But I think that stress management and relational management is a really big player in a healthy microbiome and healthy barriers.
I'm so glad you brought that up. We actually just had a conversation in the company just about how some of us were in relationships, and during those relationships, when they started to become not a great relationship, it was like we had these manifestations of things going on in the body that were very visceral, that we could feel. Some people were like sick for a long period of time, and then all of a sudden you get to this place where you're not in that toxic emotional place anymore, and your body heals. So I think it's so powerful. And I worked with so many women kind of going through menopause and perimenopause and hormonal issues, and stress is just, it affects everything. So
Yeah.
thank you for bringing that up for sure. That's such an important part of it.
Never stop asking why.
Yeah,
Really,
absolutely. So it looks like we should probably open this up for questions. Is there anything else before we get to the questions that you want to make sure that we cover, or we can go to the audience questions?
I expect we'll probably get a question around perimenopause and menopause. I don't know if you can see that, but that's a topic that is
Absolutely. That's actually one of our questions. How does microbial diversity, I don't know how that's worded. How does microbial diversity shift, and how can testing guide supportive interventions during this transition?
Yeah. Okay. So really interestingly, if you look at a bell curve over a woman's lifespan, pre-puberty, there tends to be slightly more diversity in the vaginal microbiome. That there's less estrogen present. And as we get into our reproductive years, we have more estrogen, less diversity, more, dominated by lactobacillus. And then as we get into the menopausal years, there's a tendency towards increasing diversity. And I'm not talking massively, but we just see more organisms showing up. This is all physiologic, but what we have to look at is, where are symptoms appearing? So with more diversity and that loss of estrogen, we're losing glycogen. So estrogen drives glycogen deposition in the vaginal epithelial cells. And the glycogen helps the cells to mature and proliferate. And so with that estrogen and that glycogen, we have thicker, more pillowy vaginal mucosa. that glycogen is broken, that the glycogen present in the vaginal tissues is broken down and becomes fuel for the lactobacillus. So, there's a cascade of events related to the decline in estrogen that, it's not just that, oh, we have less estrogen, therefore the vaginal tissue has changed. The food supply for the lactobacillus is changing with that change. And so what does that also mean about the pH? And I think it's really important for us to keep in mind, as I said, we want to maintain a healthy balance, but a healthy balance for a 65-year-old vagina is not necessarily the same as a 25-year-old vagina, right? So we have to not always orient towards youth in this regard. So we do need to be mindful, right? Because with less estrogen, the tissue is more vulnerable, it's more sensitive. And so, I think there's two things I want to say. One is, I think it's a really good idea for women to, speaking of preventive medicine, get a vaginal health kit, test yourself at 40, test yourself at 42, test yourself at 44, right? And get a sense for how is your system changing as you go through those hormonal changes and transitions, and adjust accordingly. I do still think taking lactobacillus is beneficial. The vaginal balance formula that we have with Microbiome Labs also has cranberry in it, which is the dose that we have in there is the exact dose that's been researched to prevent as well as treat a low-grade urinary tract infection. And, I think most of us are aware of or becoming aware of the fact that the urinary, the urethra and the urinary tract mucosa is also sensitive to that change in estrogen. And it becomes more vulnerable to pathogenic species as well. So, how can we be mindful to support our tissue, to supplement in ways that is beneficial? And, if you're testing and what your baseline is, you may be testing, 2 years into menopause, and you're able to see, okay, I'm not getting into a super high diversity here. I've still got enough lactobacillus. Like, this baseline may be healthy and sufficient for me, or, oh, look, I am more vulnerable to some of those pathogens. It's probably a good idea for me to supplement. But it's, I think we're getting into that sort of individualized medicine here where, some people's tissue is going to be a lot more sensitive to that loss of estrogen. And I think it's important to monitor, and I think to the point of the really cool integration of all of this information is like in that portal, I'm plugging Biocanic here. That portal, it's like if you've got a Dutch test and you've got your blood work and you've got your gut microbiome test and you've got your vaginal health test, you can create relationships and an understanding between all of those with what's happening. I think we're able to orchestrate a truly individualized approach for supporting women as we age.
Yeah, 100%. And that's always been our goal, to kind of enable practitioners to be able to see that for their clients, but also enable the clients and to be able to see that for themselves and really get a full picture of that. Something that came to mind also is one of our other partners, Mira. It'd be interesting also, like, I know going through perimenopause, that's, it's a device that kind of measures your hormone metabolites, estrogen, progesterone, throughout the month. So to kind of see how those change as you're also doing the vaginal microbiome test, I think would be interesting to kind of see how those play as well.
Yeah. Yeah. Oh yeah. There's so many ways that we can nerd out on all of
this. Well, there's one more audience question, and we're kind of wrapping up here. So how should we you just kind of touched on this, so I feel like this is perfect. How should practitioners think about probiotic selection or microbiome modulating supplements after reviewing test results? Are there specific strains or categories that matter most?
Yeah. As you can tell, I am capable of lots of tangents. So I would say, there is, okay, if you look at a gut microbiome test, and or you're integrating a vaginal health kit in that, there's so many different patterns, right? Like, so we're looking at relationships, we're looking at the dynamics, we're addressing the drama of the whatever's going on in the microbiome. For some people, we really are just needing to support the species that are going to be really like the keystones, right? That are going to be really instrumental in maintaining balance, maintaining resilience. And it's not so much about addressing anybody who's, let's just say, who's misbehaving or who, a pathogen who shouldn't be there. And I do want to say that with the whole genome sequencing, it's not that we're not screening for pathogens, because we do look for them. And they are present in a good number of tests that we look at. But we're also looking at what enabled them to be there. And so if they're at low levels, if we can redesign what's happening in and among those relationships, we can effectively edge out those species. And so one way to do that is to use the appropriate prebiotics, because you're basically just emphasizing the positive, like, who do we want to be here? Who do we want to support? We're going to raise up those populations that we really want to be thriving. So I know there are a couple of companies out there that have what would be called a precision prebiotic. Microbiome Labs has one called MegaPre, which I love. It is one that you really need to go low and slow with until you know how someone's microbiome is going to respond to it. So we usually start people on very small doses of it and work them up to a more full dose, because sometimes it can come in a little hard and fast. And that's the case. You've probably seen this. Prebiotics require a bit of just TLC with a lot of systems. Now, another approach, and this is part of what I love about Microbiome Labs and why I was tracking them for so many years, is because, again, like I am definitely very married to my systems approach, my systems thinking. And I came from an environmental studies background into naturopathic medicine. So it's really that mindset, I think, applies to all systems, right? It's like, we really need to be mindful of what's happening, big picture, but also relationally and from a balance standpoint. So the spores that are present in the Megaspore biotic are really nice. It's a really nice combination of they're spores, but organisms that effectively I like to say they have wisdom. So they are able to make it to the gut, and then that's where they activate, right? Like the acidity, once they get into the intestines, activates their active state. So, for example, HU58 is one of our single spore brands or lines, and that one has the capacity to effectively monitor the environment that it's in and determine which species and which strains should be there and which ones shouldn't. So it's kind of like, in some cases it comes in as the sniper and gets rid of who's not supposed to be there. And others, it's like, hey, we need to break up this relationship. I want you to get out of here. It can be a gentle recalibration, but it can also get in there. It has a property called bacteriocin, which effectively does, create a toxic environment for certain organisms. So I really like that approach, because when you take like an herbal approach or, an antibiotic approach to dealing with dysbiosis, you're taking out the good species as well, right? And potentially increasing the inflammation load on the system in the process. So it can be a pretty bumpy road and a long road, and you go through the kill phase and then you have to restore and heal and all this stuff. But the wisdom of the spores and I would say sort of the elegance of doing a prebiotic alongside, it really creates a more, you're finessing the system to bring back, and keeping that systemic mindset to orchestrate something that it's a lot more elegant than just kind of like, coming in and obliterating the organisms and then having to clean up the mess. Does that make sense?
Absolutely. That makes so much sense. Yeah. And I think that you having that holistic systemic approach and being able to see that probably brings so much to the way that you work with with microbiome and the way that you are able to kind of see the correlations and bring it all together. So I really appreciate your insight on all of this. This conversation has been really fascinating and so insightful. I think it's going to be really helpful for so many of our listeners. If you we're not able to join live today and you are listening to the replay and you do want to leave any comments, please leave comments, questions, and we will also respond to those wherever you are listening or watching this. I do want to thank all of you who did join us live today. And I want to definitely thank you, Dr. Jeannie Achuff. That was such a great conversation. And I want to make sure that you tell people where they can find you, find out more about you, your clinic, and how to work with you and work with the labs.
Yeah, so my primary role these days is with Microbiome Labs. So I'm there doing educational, things like this podcast, doing speaking events at various times around the country, and doing the clinical testing consultations. So if you run a biomefx test or a vaginal health kit, you can sign up for a consultation with one of our clinical science liaisons. And then you get an hour of one-on-one conversation, really looking at the tests that you ran and looking at the clinical implications of what's going on. So that's really fun. My active practice is in California, so I can still work with California-based patients. My clinic website is Origins of Health Natural Medicine. And you'll see I had a practice in British Columbia, but that is now closed. So just available to the Californians at this point in time.
Well, perfect. We'll make sure that we link all your information below in the show notes, as well as the information from Microbiome Labs, so they can get more information about that if you all are interested. I do want to invite you all to the next live stream. We'll be taking a break for the holidays, but we will be back January 15th with Heart Math. Should be another great conversation. So thank you again so much for being here. Really appreciate your time and educating all of us in this very, very important health topic.
Yeah, thank you so much for having me. And thanks for tolerating all my tangents.
Tangents is the best part. All right.
Enjoy the holidays.
You too.
All right.